One of the most common questions patients and families ask me is, Doctor, how did we reach this diagnosis? And how do we know surgery is the right step? The journey from the first symptom to actually being wheeled into the operation theatre can feel confusing. So in this video, I'll walk you through that entire path from noticing early symptoms to investigations, diagnosis, staging, and preparing for surgery. Hello, I'm Dr. Vivek, GI Onco-Surgeon at SSO Cancer Centre. My work focuses on cancers of the stomach, colon, rectum, esophagus, and other digestive organs. For patients, the path to surgery often feels like a maze of scans, scopes, and tests. But each step has a reason. My aim here is to simplify that journey so you understand how we go from symptoms all the way to the operation table. Most journeys begin with a symptom: rectal bleed, a lump in the abdomen, unexplained weight loss, persistent acidity, or difficulty swallowing. It's important to know that many of these symptoms don't always mean cancer, but they are red flags that should never be ignored. So the first step is usually a visit to a physician or gastroenterologist who will recommend basic tests or a referral to a cancer surgeon. The simplest and most powerful test in GI cancers is endoscopy, whether colonoscopy for the large intestine or upper GI endoscopy for the stomach and esophagus. These allow us to directly see the tumor. A biopsy is then taken, a small piece of tissue sent to the lab. This confirms whether the growth is cancerous and tells us the type of cancer. This is the point where diagnosis becomes clear. Once cancer is confirmed, the next crucial step is staging, figuring out how advanced it is and where it has spread. For this, we use imaging tests, CT scan or MRI, to map the tumor and nearby organs. PET-CT scan, in some cases to detect spread to distant areas. Endoscopic ultrasound in the esophageal or rectal cancer to check depth of invasion. Blood tests and tumor markers may also guide us. Staging helps us decide, is surgery possible upfront? Do we need chemotherapy or radiation first? Or is surgery not the safest option at all? Equally important as staging is assessing the patient's fitness. Major abdominal surgery is a stress test for the body. So we evaluate heart and lung function, ECG, echocardiogram, chest tests. Nutritional status, because malnutrition is common in cancer patients. Blood counts, kidney and liver function. Sometimes pulmonary function test or cardiology clearance is also required. Optimizing the patient before surgery reduces risks and improves recovery. At SSO Cancer Centre and in most modern cancer centers, we never take decisions in isolation. Every patient is discussed in a tumor board, a meeting where surgeons, medical oncologists, radiation oncologists, radiologists, and pathologists come together. This ensures that treatment is not just one doctor's opinion, but a consensus plan tailored to that patient. Once the plan is made, the focus shifts to preparing the patient. Nutritional build-up if patient has lost weight, prehabilitation exercises for lung and muscle strength, explaining the procedure, risks, and what to expect after surgery, sometimes bowel preparation or stomach counseling if needed. This stage is not just about physical readiness, but also about giving confidence to the patient and family. On the day of surgery, patients are admitted and prepared by the anesthetist and nursing team. Inside the operating room, before the first incision, we go through a safety checklist, confirming the patient identity, the planned procedure, and all critical details. Only then do we begin. This is the culmination of a careful stepwise process, not just from diagnosis to staging, but also optimizing the patient and ensuring absolute safety. So, the path from symptoms to the operating table is not a straight line. It's a carefully planned journey. It begins with noticing early warning signs, moves through tests and staging, evaluates overall fitness, involves multiple specialists, and finally prepares the patient for safe surgery. If you or a loved one are on this journey, I hope this video helps you see the process clearly and reassures you that every step has a purpose. If you found this video helpful, please share it with others who might be facing the same questions. And don't forget to like, share and subscribe for more patient-focused education on GI cancer care.